Okay, let's dive into this. Today, we're exploring a seriously fascinating explainer on a psychological framework that basically treats our minds like highly complex operating systems. We're going to unpack cognitive and behavior therapies, and we'll specifically zero in on how these clinical approaches identify the faulty wiring in our everyday habits and thoughts, and then systematically program much better ones.
So here is our roadmap for today's journey. 1. The roots of distress. 2. Fixing faulty behaviors. 3. Rewiring irrational beliefs. 4. Overcoming cognitive distortions. And finally, 5. The path to betterment.
Starting with Section 1, the roots of distress, pinpointing the glitch. Any effective therapy absolutely has to begin right here with something called a clinical formulation. You can't just start throwing random techniques at a wall to see what sticks. Instead, a therapist is going to gather initial material, usually in those first 1 or 2 sessions, to really understand the full scope of what the client is going through. Say a client is struggling to hold down a job because they just can't face their superiors. Well, the clinical formulation might specifically target a lack of assertiveness skills or maybe heightened anxiety. This formulation dictates the exact toolkit the therapist will use moving forward. Think of it like mapping out all the bugs in your software before you even attempt to write a patch.
But here is an absolutely crucial rule for both behavior and cognitive therapies. They operate strictly in the active zone of the present. While psychodynamic therapies might spend literally years digging through childhood memories, these therapies don't force you to actively relive the past. Honestly, the past is only relevant to figure out where that faulty learning originated. The actual heavy lifting, the correcting of those faulty behaviors and thoughts, that happens entirely in the present moment.
Moving right along to Section 2, fixing faulty behaviors, the cause and effect. Now, what's really interesting about this is how it views our actions.
So how exactly do we fix the glitch? Well, in behavior therapy, psychological distress is seen simply as learned cause and effect. To fix a faulty behavior pattern, a therapist conducts a behavioral analysis looking for 2 main gears in the machine. First, you have the antecedent factors. These are the causes or triggers that predispose someone to take an action. And second, you have the maintaining factors. These are the consequences or the rewards that actually keep that faulty behavior persisting day after day.
Let's look at a highly relatable example. Imagine a young student who has developed a smoking habit and really wants to quit. During the behavioral analysis, the therapist discovers that the student actually started smoking while preparing for annual exams. The intense exam preparation causes anxiety, so that is our antecedent factor. When the student smokes, they feel a sudden temporary relief from that anxiety. That feeling of relief, that's the maintaining factor. The operant response of smoking is just being perfectly, seamlessly maintained by the reward of reduced anxiety.
So how do you actually change this? You modify what happens right before or right after the behavior. This is called an establishing operation. Consider a child who just outright refuses to eat dinner. Instead of getting into a massive nightly shouting match at the dinner table, the parent can just change the antecedent. Step 1, simply decrease the amount of food given at tea time. Step 2, this naturally increases the child's hunger by the time dinner rolls around. Step 3, offer lots of praise when the child eats properly. By controlling what precedes the behavior, the unwanted habit is naturally phased out without all the stress.
Behavior therapists have a surprisingly vast practical toolkit to program better habits. For instance, there's aversive conditioning, which pairs an undesired response with a painful consequence. An example of this would be an alcoholic who might be given a mild electric shock while smelling alcohol, repeatedly pairing the two until the smell itself literally becomes aversive. Then, on the much more positive side of things, we have the token economy. Here, every single time a wanted behavior occurs, a token is given. These tokens are saved up and then exchanged for real-world rewards, which strongly reinforces the positive behavior.
You can even combine these strategies using something called differential reinforcement. Think about a sulking child who desperately wants to go to the cinema. There are 2 distinct paths a parent could take. Path A relies on positive reinforcement. You only take her to the cinema if she politely asks. Path B is negative. You completely ignore her when she cries and sulks. But by using both of these simultaneously, you massively increase the wanted behavior while actively extinguishing the unwanted behavior. It's a highly effective and honestly much less painful strategy for everyone involved.
For extreme anxieties and phobias, therapists use a technique called systematic desensitization, which was introduced by Wolpe. Basically, the therapist and client build a hierarchy of fear, ranking triggers from the least to the most terrifying. The client is taught deep physical relaxation techniques, and then they're asked to imagine the lowest fear on their hierarchy while maintaining that completely relaxed state. This works entirely on the fascinating principle of reciprocal inhibition, which sounds complex, but it simply means two mutually opposing forces cannot exist at the exact same time. The physical presence of relaxation literally blocks out the anxiety.
Section 3. Rewiring Irrational Beliefs, the ABCs of Emotion.
We are shifting gears now from observable behavior over to the cognitive side of the mind, specifically looking at Albert Ellis's rational emotive therapy, or RET. And this brilliantly illustrates the absolute core of Ellis's theory, the ABC analysis. We naturally tend to assume that an antecedent event directly causes a consequence. For example, failing a test automatically causes depression. But Ellis points out a vital, hidden step right in the middle, B, our beliefs. It isn't the event itself that causes our distress. It's our irrational belief about the event that distorts reality and creates that negative consequence.
These irrational beliefs are very often characterized by absolute musts and shoulds. Listen to this classic example. One should be loved by everybody all the time. Now ask yourself, have you ever secretly held a standard kind of like this? These types of beliefs are simply not supported by any empirical evidence in the real world. When a person holding this belief inevitably meets someone who just doesn't like them, their entire distorted reality collapses, which leads to severe emotional distress.
Section 4. Overcoming Cognitive Distortions, Unpacking the Schemas.
Here, we're diving into Aaron Beck's cognitive therapy, which really focuses on the deep, sometimes totally invisible frameworks of our minds. Beck proposes that our childhood experiences build deep-seated core schemas. If a child is neglected early on, they might develop a core schema that just says, "I am not wanted." Now, this schema sits silently in the background until a critical incident in life triggers it, say being publicly ridiculed by a teacher. That incident forcefully awakens the schema, which then generates sudden negative automatic thoughts, leading to intense cognitive errors about their social reality.
These negative automatic thoughts sound something like, nobody loves me, I am stupid, or I will not succeed. They are persistent, totally irrational, and they completely warp a person's perception of reality. These are known as dysfunctional cognitive structures, and repeatedly experiencing these thoughts, well, that is a direct pathway to profound anxiety and depression.
So the crucial question is, how does a therapist actually dismantle these deeply built structures? They do it through gentle, non-directive questioning. You see, a good therapist won't just flat out tell a client they are wrong. Instead, they will ask things like, why should everyone love you? Or what does it actually mean to you to succeed? This non-threatening disputation forces the client to look at their own thoughts objectively. Ultimately, the client actively challenges their own dysfunctional schemas and realizes their own cognitive distortions.
Let's move to and see how this builds into Section 5, The Path to Betterment, a New Philosophy.
So what is the ultimate endgame of pulling apart all these behaviors and hidden schemas? The real goal is to install a completely new rational belief system. Through the highly structured methods of behavioral analysis, differential reinforcement, and cognitive reframing, the client literally replaces their faulty mental wiring with a newly adaptive philosophy. They learn that while they absolutely cannot always control external events, they can control the beliefs that mediate those events, which directly reduces their own psychological distress. Which brings us to the end of today's explainer, leaving us with a pretty powerful thought to chew on. If your own mind is essentially an operating system running on a mix of learned behaviors and deep core schemas, which faulty pattern in your own life are you going to identify and actively rewire today? Thanks so much for joining me, and keep learning.